Okay, so we have a briefing and discussion on reimagining public safety initiatives, decoupling activities, and reinvestment opportunities. Then that will be followed by a briefing and discussion on the Austin Police Department's Austin Regional Intelligence Center, also known as ERIC, and then a briefing and discussion on the Austin Area Wildfire Hub in response to the Wildfire Preparedness Audit Report, August 2019. In which case, let me check in with City Hall. Are we prepared for our first briefing?
Yes, we're prepared.
Thank you very much. I appreciate it. You can go ahead and call them up.
Thank you, Mayor Pro Tem. I'm going to kick us off as City Hall gets our slides. Thank you so much. My name is Nuria Rivera Vandermeid. I'm the Deputy City Manager, and I am so pleased to be before you to sort of give an update on where we are on our Reimagining Public Safety activities, as well as a brief update on some of the reinvestment activities and a little nod to where we are with the task force. So if we go to the next slide. I'll try to kick it off, but there are people behind me, as you see in the room, that actually are doing the work. And so I will high level speak to some of the work that we've already done and some that is in flight. As per the budget amendment and instruction that Council gave to us in August of last year, we have started this process of decoupling, right, of looking at areas within the Austin Police Department that could perhaps be stood alone or be serviced by other departments. And so, as you all know, we had started the move for support services in the fall. HR and PIO had already begun and were assumed within our corporate HR and PIO. I'll note that under review or in progress are finance and building services, but those are two in progress, and we'll be reporting on that at some point in the future. Our special events, we had administrative personnel shift over to DSD in the fall of 2020 as well. Our sworn personnel had already been reassigned to emergency management type duties in the face of pandemic, and why we will always need sworn to be involved in some of the special events, permit review, and some events as events emerge in the future, which with the vaccinations, I think we're all excited about events emerging in the future. But those personnel will not necessarily be dedicated to just permits and special events, but will be reassigned as APD leadership requires. The Forensic Science Bureau, as many of you know, we came before Council and you approved standing that as its own department. And so that aligns with some previous reports that had been asking to establish an independent DNA lab in the past. And so really happy to have that moving forward, that approved, and staff continues to work on the next steps for that. We had, as part of the decoupling, you asked us to take a look at some of the communications, but in particular the 911 call center. In the advent of the storm and some of the recovery efforts, many of the folks that are working on RPS are also in the midst, or were responding to some of the emergency crisis and then subsequent recovery activities. So we had some meetings lined up with 911 staff. We will pick those up again, and I believe those are scheduled. And so hope to come to you soon with some thoughts about the next steps there, but really need to speak to APD staff to better understand some of the alignments and some of the adjacencies with some of those programmings. There are some other issues we have been talking through with victim services and internal affairs. And as I mentioned, support services we had talked about. There are others that are kind of a little bit further down the pike, and we will continue to update Council as that moves forward. Have not yet taken a deep dive into strategic support, community partnerships, or the Special Investigations Unit, but that is next on our horizon as we move forward. Just a reminder too, and I know that we have faced these questions from our task force as well as other folks in community, What we are doing as we proceed with decoupling or looking at areas which perhaps could be either done by others or stood on their own is really thinking through the administrative aspects of it. But as we have shared with folks, there will be continued conversations about perhaps how the services are offered, and there will be opportunities for community or the task force to continue to give us information as we delve into business process improvements along those natures. Next slide. We have several upcoming meetings with the task force. That work continues to flow. It is a large volume of work, and I certainly appreciate staff who has been a part of it and the Reimagining Public Safety leadership team as we have done it, but really importantly, appreciate the time and the work and the commitment that our community members on the task force have put in as we move forward. You'll see there that we have several, I believe it's 9 working groups established. As indicated in a previous memo to you, we will be coming back to council on August 20th to talk through both your request to see staff and do a kind of a mid-year check-in. But that was also asked by the task force to add some additional time for community engagement to make sure that their recommendations could move forward as well. Certainly they were feeling some pinch of time as we move that forward, but frankly, the storm and the recovery efforts where everybody, not just staff, but it seems like the entire community was helping each other out, has pushed some of those out. So we appreciate your grace in allowing us to come back on April 20th. So we will be talking through some of those recommendations, and you'll be hearing from the chairs of the task force directly. We've got several upcoming meetings. As you know, our meetings are public, and so anyone who wants to tune in can see that schedule there. We actually have one this very evening after this meeting. And we have a community listening session as well on Saturday, April 4th. So again, very high level update just on where staff is as we're picking up those efforts post-storm. But in the meantime, there has been some tremendous work done by staff, particularly on the reinvestment portion of that, and I am going to pass the baton to Austin Public Health and Assistant Director Adrian Stirrup to get us kick-started there. Next slide.
All right, good afternoon. Thank you. Adrian Stirrup, one of the Assistant Directors at Austin Public Health, to talk very high level about the reinvestments. So the Family Violence Shelter and Protection Services, that was a budget allocation of $2.1 million. That RFA is out on the street. The application process will close on the 23rd of this month, and we are hoping to have a contract in place by mid-May. 6.5 was allocated for permanent supportive housing and services, and we are in this first year allocating that for support of the hotel strategy and of the mainstream voucher program to couple the supportive services that need to go with those housing vouchers. Office of Violence Prevention was 1.8 million roughly. About 1.2 of that is for reinvestments in community. So on the staffing side, we are recruiting for the lead position. That posting actually closes tomorrow. We've been meeting with national leaders in this space to help us plan around the setup of the office and to help us make sure we select the right individual to lead that work. On the reinvestment side, we are working on several pilot projects for this year. One has a focus on sex workers, and then the other ones are trying to see where we can augment efforts currently being supported by the Equity Office Reinvestment in Public Safety grant process, and also some existing programs in community so we can begin to really gather data and scaffold up what the office will look like in the sustainable future. For substance abuse, there was $1.1 million, allocated to the budget. 3 agencies successfully completed the application process, and those awards will be on the council agenda on March 25th. For food access, it was $400,000 in funding. We're working with Equidot ATX to set up a pilot program where they will retrofit a Cap Metro bus to provide grocery style services in the Eastern Crescent. Abortion access, $100,000 additional dollars were added to this year's budget. And that contract is through Jane's Due Process, and they will continue to provide logistical and support services for women considering their options when it comes to their pregnancies. Next slide, please. So with the pot of funds, that 1.125 that was targeted or as reinvestment in public safety, there were two categories that were pointed out. One was mental health services and the other was immigrant legal services. And so for this first year, we decided to add money to our existing mental health contracts with some of that money. The other thing was to beef up the contracts that we have with American Gateway, who has been doing good work with deportation assistance, and also with Catholic Charities, who has been doing great work on behalf of the city, providing all types of legal services for immigrant populations. There will be a competitive solicitation for the bulk of the money. We are looking at beefing up some existing partnerships in community as well around domestic violence, youth violence prevention, and African American mental health, specifically targeting youth. And all of that is around the strategy about how can we get to this public health approach to prevent those populations from entering into the criminal justice system unnecessarily. As far as our epi and disease surveillance programming, we added the 4 epi positions to the department, and that has increased our capacity not only for COVID-19, but for other reportable conditions. And it has also improved our epi response. And you can see the stat there about how many EPIs a good public health department needs per 100,000 of the population. Early childhood has been a focus for the city for a long time, and with this funding, we were able to make the coordinator position, move it from a temp to a full-time FTE. And during the COVID response, that person has been working within the social service branch of the EOC to support not only childcare in schools, but families in figuring out what education looks like during this time. But the bulk of this person's work is really focused on achieving those outcomes that were identified in SD 2023. And last but definitely not least, as part of the reinvestments, we were able to increase the Workforce First program. And so that contract now totals about $1.2 million, and it supports 4 work crews 5 days a week, working in coordination with PARD, Watershed, and ARR, not only providing a valuable service to our community, but also supporting persons experiencing homelessness. And I believe those are all of my comments. And if there are any questions now or at the end, I am available.
Thank you very much. I think we'll hold our questions to the end, unless, of course, Deputy City Manager and Adrian, unless, of course, that was the end of the presentation for this one.
It is not, Mayor Pro Tem, and so we'll continue if we do the next slide. We've got a rolling group here of really talented folks to add more to the slide deck. So, Brian?
Hi, everyone. Brian Oakes, Chief Equity Officer for the City of Austin. So the Equity Office was assigned with $400,000 as part of the reentry services for formerly incarcerated population. And we are moving forward with the process to do an RFP for these services. One of the unique things that we've done with this opportunity is that we quickly realized that none of our staff had direct experience with being previously incarcerated. And so before we actually officially began the RFP process, we put in place a community engagement process that we started back in December, and that community engagement process is actually being actually performed by people who have been previously incarcerated. They are leading a series of focus groups with people that have been previously incarcerated to get a better understanding of what are the challenges and issues people face when they re-enter into our community. They also are doing focus groups with family members and loved ones of people who've been previously incarcerated. Families play a really huge role in a successful reentry, and so we're better trying to understand what those experiences are and those challenges are. We got sort of set back a little bit by the winter storm. We actually had some focus groups that were scheduled for that week that needed to be rescheduled out. But once we sort of gather that information, we're sort of projecting the launch of the RFGA in May of this year. And just some insight also in terms of how we sort of structure the request for grant process. We want to sort of pull in some of the same sort of strategies that we're doing with our equity mini grant program, which is that through this program, we would actually hope and want to try to incentivize organizations that are being led by people who have been previously incarcerated to really apply and hopefully be successful in securing some of this funding. So we would be looking to do things like lower liability limits when appropriate and necessary. Also looking at options for shorter or more simple contracting options, as well as application to apply for the funding as well. And then also the consideration of how we make funds, a higher percentage of funds available on the front end of being awarded a project, as opposed to sort of our traditional fee for service approach that we do with a lot of community-based organizations. And next slide.
We will pass that over to Assistant Chief Gay.
Thank you, Brian. Thank you, Nuria. Chief Gay with the Austin Police Department. Excited to be here today, and council members to report on APD's reinvestment activities. For victim services, we reinvested about $500,000. Happy to report that that included 4 FTEs for victim services, 1 supervisor and 3 counselors. Those positions have been filled. So that's a great for victim services. Also, we were able to use about $30,000 to provide stipends to our graduate students for both Texas State and University of Texas. We actually were able to get 7 students for the spring semester, and they will be our first recipients of a $2,500 stipend. We do anticipate we'll have some graduate students for this summer as well. Also, we invested $15,000 into emergency assistance for victims of crimes. We have been using those funds for food and for clothing for our victims. So that has been very useful. So we appreciate that. The next is the targeting training for trauma-informed responses. This is really an investment of about $50,000 for EMDR. This is where we are training local clinicians in the area that are trained with EMDR. Because of the training that they will receive, is they do 50 pro bono counseling sessions with victims of crimes in our area. This is both for sexual assault victims as well as other violent crimes. We currently have about 110 counselors in the area that are doing pro bono work. Some of them have actually decided to stay on beyond their commitments, and with this $50,000, we'll have about another 45 to 50 additional counselors in the area. In regarding the unconscious bias and racial and cultural sensitivity, this is really our work with the Equity Office. The 2 reports from Ms. James, as well as the equity assessment that was recently released. We are using that as a baseline, and hopefully we'll bring a contract to council asking for a professional services contract for 3 to 5 years to offer training to our leadership team, as well as to all our employees in this arena. So very excited to bring that forward here in the next few weeks to council for approval. The last is the Naloxone. We have already purchased this for all of our department officers to carry. We are in the process of working with the medical examiner's office on a training to push out to all of our officers. We anticipate that that will be finalized, and our officers will be carrying this tool in within the next 4 weeks. So excited to report that. So thank you. I'll pass it on now to, I believe, EMS.
Good afternoon. Jasper Brown, Chief of Staff with Austin Travis County EMS, and also with me will be Assistant Chief Andy Opmeister to go over a few other bullet points. In August, Council invested in our COVID-19 resources and additional resources for 911 response. There was 2 ambulances added to the system. One was added in October of 2020, and we just added the 2nd ambulance in March here yesterday. It went online full duty. It was delayed a little bit because of the ice storm, but it is on duty 24 hours a day, 7 days a week as of yesterday. And so next slide for Chief Opmeister.
Good afternoon, Andy Opmeister, Assistant Chief with EMS. In this last budget, in this year's budget, there was an investment made in the community health paramedics program, and the intent was to deploy them to begin being responsive to those mental health crisis calls that come in through 911. We're deploying 2 CHP units 24 hours a day, 7 days a week. Here we're starting next week. Those that are going to be assigned to those units have already completed over 40 hours of mental health training that was collaboratively provided through Integral Care, and they've done clinical rotations with some of their specialized programs within their organization. And we've identified the additional 2 members that will be coming online when those positions are funded either mid-year or later. And based on staffing levels, we'll bring them over and get them out on the streets as well.
Update on our ET3 project, the emergency triage, treatment, and transport. It was originally slated to schedule start in 2020. It was delayed due to COVID. The program began on January 1st, 2021. We do have our participation agreement completed with the CMS, which is the Centers for Medicaid and Medicare. They've approved the plan. We've have a partner agreement with WellMed. They have about 17 alternate destination sites, and we're completing some of our other participation agreements that will be needed for alternate transport. We're also testing some telehealth resources into the field, and we actually did quite a few of that during the ice storm when we had our consult line with paramedics that were dealing with COVID originally. They began to take on local telehealth along with the medical directors, and we're able to keep people at home instead of transporting. So we started the telehealth actually during the ice storm, and we'll continue to expand upon that. Next slide.
Also in this last budget, there was an investment made for mental health resources. It pertains to the host. This particular program that was the partnership between the city and the Downtown Austin Alliance and Integral Care and that to roll this resource out to work with host. It's coming online. Host has worked with the team or the team members that are on board. They've identified 5 clients that they're already working with. Integral Care has 3 team members that are already on board and actively working in the streets and working with the host team, and they're working to fill the remaining positions. And so with that, with them coming on board, host is working hand in hand with this new resource and kind of familiarizing them with the process and the system. and actually helping train and getting out in the streets and working with some of the individuals. So as it relates to that resource, that's what's been provided so far.
Robert Kimber with the Downtown Austin Community Court good afternoon, and just want to give a brief update regarding the increased funding for the EMCOT contract, which is an expanded mobile crisis outreach team. It's an interlocal agreement with...
Mr. King, I'm going to get you to hold just one moment, please. There's some feedback. If you're not speaking, can you please mute your microphone? Thank you. Much better. Please proceed.
Okay. So this is an interlocal agreement with Austin Travis County Integral Care that has been housed at the Downtown Austin Community Court since FY19. The new funding that was provided in FY21 was an increase of $1.5 million, which brings the total contract amount up to $3.2 million. The three main objectives during this budget period with the increased funding was to deploy iPads to provide telehealth appointments with the Austin Police Department officers and EMS on site with a behavioral health specialist. One of the primary goals of this additional funding was also to provide staffing 24/7 at the 911 call center to receive calls regarding individuals experiencing mental health crisis and divert an APD or EMS response and provide a response on site with a behavioral health specialist. And then the last item with this additional funding was to provide full-time access to a medical provider, including a psychiatric care provider to support expansion of services that are being provided both through the 911 call center as well as on-site EMCOT crew members. And with that, I'm going to turn it back over to Chief Opmeister with EMS for the next slide.
All right, thank you, Robert. Myself and BJ Wagner from the Meadows Mental Health Policies Leader are here just to provide a brief update on the work that's being done to implement the Meadows report recommendations from 2019. As you remember, that report came along on the heels of the city auditor's report, and in 2019, May of 2019, the Meadows Institute provided 6 recommendations for us to look at and to implement. We brought the Meadows Institute back and kicked off this work in October of 2020. So just to go recommendation by recommendation, recommendation number 1 stated that an advisory function should be developed within the Behavioral Health and Criminal Justice Advisory Council that could provide information and advice and some sort of oversight to some extent in terms of how the police and others respond to criminal or to mental health crisis incidents. So we're happy to say that recommendation is complete. Last month, Chief Joe Tricone and his team were able to work with the BHAC, as we refer to them, and they approved this particular function within their group. So right now they're working on getting those reports quarterly, and they're working on the format and some of the formalities there. Recommendation number 2 was made the recommendation that there be additional mental health training for call takers in the 911 center. And so currently what we're doing is the Meadows Institute is helping us identify best practices from across the country in this particular topic. There are very few locations that have or provide this type of training, so it's not readily available to take off the shelf. But the Meadows Institute has staff working on developing and reaching out to different services or different locations that have training that may fill some of these gaps, and then we'll bring it back and we'll put it together and deploy that training. Recommendation number 3 made the recommendation that mental health clinicians be integrated into the 911 process And so, as you heard from Robert Kingham, Integral Care has brought on several clinicians, and they have been working in the APD area of dispatch, and there's one also stationed over in the EMS section of the dispatch or the communication center. Early last month, APD launched what we're referring to as the fourth option. So when someone calls 911, they'll be asked whether they need police, fire, EMS, and now they'll be asked if they need mental health services. APD has worked out and is working on the process, and essentially what that does is that brings in the mental health resources as quickly as possible. And then Integral Care continues to recruit and fill the positions for the clinician in the center. They're not able to staff 24/7 right now, but we anticipate that they'll be up and running in 24 hours with a clinician in that center by May 1st. Next slide, please. Recommendation number 4 spoke to the sustainability of MPOT, and in this particular discussion, rolling out telehealth and expanding that capability to include APD and EMS units. This is currently in progress. Integral Care purchased a large number of iPads, and those are currently being distributed to APD staff, and there will be a very short period of training provided, and we anticipate that this resource will be up and running by the end of this month. Recommendation number 5 relates to developing a formal collaboration and process where APD crisis intervention officers and the team have a connection to the EMS community health paramedics, so that appropriate cases can be referred over and work with either our medics or the Integral Care clinician that we may partner or that we're partnering. That is currently being memorialized and formalized through policy. There's already very close connections anyhow between these two teams, but we're working on getting that formalized and seeing what we can do to enhance that particular referral stream and process. Recommendation number 6 relates to community outreach and working with NAMI and other resources to get information out about mental health crises, what an individual can do to prepare for situations like that, what's available in the community, what to expect if they have to engage the emergency services system for mental health crisis. We're currently reviewing material, and then we're also looking at what populations, what areas. We've already received that information through the Meadows report and other avenues, but we're also looking at what media outlets can we utilize, and social media, radio, television, what connections, what groups do we have relationships with that once we approve or once we get all the resources together and the materials that we can engage to roll out for the community. I believe that's the last slide that I have, or any of the updates that I have. I'm happy to take any questions.
I appreciate that, and just wanted to allow, before we go to questions, Mayor Pro Tem, to allow Ms. Wagner, if she had anything to add to that last presentation, really about the Meadows report and the great work that she and her team did that. But certainly we stand ready for additional questions after that, and let us know. I know we put this presentation as part of backup. Let us know if you would like us to take it down so that we can see each other more fully. Ms. Wagner?
Sure, and thank you, Nikki, for having me today. I think Chief Opmeister covered it really well. This work took a lot of digging into when we first got started, because as we all know, things around the world, but certainly in Austin, are very different now than they were in 2019. So we wanted to make sure that we had high fidelity to these recommendations, because they are data informed. Issues were identified, which the recommendations were created to address. So maintaining the fidelity to the recommendations while also addressing many of the changes that our community has seen since the report was issued was very important. For instance, on the last recommendation, number 6, originally, because we identified statistically significant increase in response to resistance and use of force instances in Spanish-speaking communities where the poverty level was below 200% of the federal poverty level. We had designed intimate but intensive community outreach events to take place at culturally relevant locations across those areas in person. And we know now that's not an appropriate outreach activity now in the city of Austin. So we're reevaluating how to make sure that that educational material can get out to those communities, that we can ensure officers who are working in those communities have the appropriate information, the NAMI, what to do kind of information, that it's all translated and distributed in a way that makes sense now in 2021. I will say that there's been a significant amount of national interest in the fourth option that was added to the 911 answering, but also in the unique way that we are implementing mental health triage and consultation in the call center. We're working to finish risk matrix call treat, if you will, to determine when those calls can be transferred out of the public safety arena, but also looking to determine when and how to ensure a clinician is available for consultation and guidance on those calls that are still going to require some kind of a public health require a public safety response. Because we know that it is when those public safety responses happen that we often see tragedy, and we want to be able to maximize utilization of those clinicians to ensure consultative activities are available to those responders to minimize or eliminate the risk of tragedy on those calls. And there's been a significant amount of national interest in how Austin is weaving both of those into the call center, triage, diversion, and consultation all into one, which is really taking hold now. We're making really great progress there as well. And as far as the training piece, we know that those dispatchers have received mental health first aid, but we also know that that is not sufficient to meet the need here, but we don't want to replicate any kind of training they've already had. So we've identified some of the elements in mental health first aid that we don't want to repeat, and how we can now add on emergency mental health dispatch and resource training in a more truncated fashion. And again, create a training not only for the dispatchers, but for the clinicians that have the opportunity to be a first in the country type training. We will seek accreditation through TCOL for the clinicians who go through their part of the training, as well as be able to liaison with TCOL on the creation of a new emergency mental health dispatch training for your call takers and dispatchers, again, setting a state and national standard. So I'm pleased with the progress that we have recently begun to make on this project, and I'm excited to see it continue to unfold. We'll have our interim report due to the council at the end of April, and I think that you guys will be pleased to see the changes and the progress that your city is making as well.
And with that, Mayor Pro Tem, committee members, I know that you have two other presentations, but know that staff stands at the ready for any questions on this presentation.
Thank you very much, Nuria. I think we'll go ahead and offer the opportunity for folks to ask questions on this particular presentation. I need to figure out my layout because I can only see 3 people, but I know. Okay, there it is. All right, colleagues, are there any questions? Vice Chair?
I have a question, Mayor Pro Tem. Oh, sorry.
That's all right. Thank you all for the presentation and all the really hard work done so far. I think that our city is really a leader across the country around this year, trying to make committed investments in things that will make our community more safe. And so I appreciate what you have in the presentation, and I just want to make sure that that maybe y'all can answer for me if any of these investments, if I don't have the timeline right. But on housing for folks experiencing homelessness, I know we've made some investments in the hotel strategy, but there's still more investments to make. I think that that's where we stand with that. And maybe my question at the end of this is, let me know if I got any of this wrong from the presentation. But on housing for folks experiencing homelessness, we've started to make some investments, but that you're in the hotel strategy, but you are going to bring more to us on the mental health first responder program. You've established that mental health at 911 last month, but there's going to be continued investments and rollout in that program among staff and training. And then on the Civil Rights Office that I didn't see on the PowerPoint, but that I think was part of this year's budget, that was established last month. We passed the abortion access expansion, I think this month, so I think that one's done. From the slides, it looks like you already have expanded the job programs for Workforce First. Let me know if there's still expansion to do or if that's complete. Family Violence Shelter, you said, is coming in May of 2021. And Substance Use Services, Immigrant Protection, and Food Access would be coming this month to council. The Forensic Services Department, being independent, we did last month. It looks like you're saying support services and special events have been decoupled already to the extent that they're going to be. And then the victim services professionals and resources, it sounds like, that's already complete and has been put into effect. Did I get any of that wrong? I'm just trying to synthesize a bit of a timeline coming out of the PowerPoint that you all have given to us.
Sure. I will say that, yes, we were remiss in not adding the Civil Rights Office. Carol Johnson is our new Civil Rights Director, and I'm excited for you all to get to know her as she has now joined us in the city. And I will say that with regards to some of the on the under review portions, which includes victim services, we are certainly continuing to have that conversation, as well as some other aspects that were asked to be decoupled. And we, not quite finished, but we will be bringing that forward with fuller recommendations in the near future.
Sorry, when I said victim services, I guess I meant to Chief Gay's point about hiring the additional staff that we put in the budget, that is complete, or is that sort of still in process?
The new 4 FTEs have been hired. We do have some other vacancies in victim services, but those have been hired, yes.
The new ones have been. Okay. Oh, and then on the EMS front, have we finished and it looks like maybe Assistant Director Stirrup will be able to modify something I said on there too, but also on EMS, I missed whether or not the new investments in EMS have all been completed and hired, or if that's still in process.
The units have started and the hiring is in process. We started the units ahead of the hiring process, so the cadets will be hired and promotions will occur throughout the fiscal year.
And just a small clarification on the Workforce First. All of the money for fiscal year 21 has been added to that contract, so that process is complete.
Great. I just think that we had so many people from across the community come together and push on the city council for all of us to work together to try to get a lot of these new programs off the ground. And I think that this presentation really speaks to how quickly the city has moved to get a lot of this running across so many different programs. And so I really appreciate this update.
Councilmember Kelly.
Thank you very much. And thank you to all the staff involved in lifting this heavy load of reimagining public safety. I know you all are working really hard to put the right programs in place to make it successful. I wanted to back up for a moment to Assistant Chief Gay's presentation and briefly touch on the targeted training for trauma-informed response that we heard about. Assistant Chief Gay mentioned EMDR multiple times. I'd like to clarify for those that might be watching that don't know what that means. My understanding is that EMDR stands for eye movement desensitization and reprocessing. It's a clinical tool that allows people to heal from the distress associated with traumatic memories or disturbing life experiences. And I'm really pleased to know that this is an additional way to help victims of crimes. And I'm really thankful that Assistant Chief Gay was able to talk with us today about that as part of Reimagining Public Safety. It's going to be a really great asset for people that need it. So thank you.
Councilmember Kitchen, I'm sorry.
No, I was just going to say thank you for giving the definition of that program. I appreciate that.
It's helpful. Thank you, Councilmember Kelly. Councilmember Kitchen and then Councilmember Alter.
Yes, I just wanted to say thank you for this update. It's as Councilmember Kassar said, I'm seeing some significant progress, and I appreciate the report on the efforts in the 911 call center, which actually began last year. It was not a new program this year, but you've made significant improvements, which is what we talked about. or expansion, I should say, significant expansion this year. And so I really appreciate the progress that's been made, appreciate the work that all of you all are doing, and working with Ms. Wagner and EMS and APD. It's truly a collaborative effort across several areas. So I'm excited about it. And I appreciate that report. And I'm looking forward to the more detailed progress report. I think you said at the end of April or in April. Thank you.
Councilmember Alter and then Councilmember Kitchen.
Thank you. This is really exciting to see this, pulled together. And I think that, the comments that Councilmember Kitchen just made underscore that this is work that has been going on well before August, well before June of last year. We've had conversations about the fourth part of the consult line. We've had conversation about needing more host teams. We've had conversations about improving victim services. We made some decisions in the budget that allowed us to make some of these investments or accelerate their process. But these are things that have had a lot of thought and a lot of research behind them that we are finally able to move forward with. We're moving forward with a lot of them at once, and I think that is exciting. I wanted to first just highlight two things that I thought were left off in terms of the reinvestments that I want to make sure are in there. We invested in what's now called the Rework Now program from Workforce Solutions. I didn't see that. I think that was something like 1.9 million. I think we were calling it like Work Repay before or something like that. But this is a program from Workforce Solutions that is helping us to train people in trades like plumbing and other things that we really see that we need right now in our community. And we have an opportunity in our upcoming discussions over the America Recovers funding to think about accelerating that type of program. So I wanted to just say that we should be adding that to our list. And Chief Brown mentioned the pandemic consult lines, but we provided full funding for those consult lines in the budget as well out of the reinvestment. And as Chief Brown mentioned, though, that service was really critical during the storm and is critical to our efforts to provide healthcare moving forward. So I think we have to, just keep in mind that there's some other things here. I wanted to ask, though, about the third bucket. So we had three buckets. We had the reinvestment, decoupling, and I'm totally blanking on what we called the third right now. But the stuff that was less clear, sort of how we were going to move forward. So I wanted to ask if you could speak to that, and if you could also speak to the proposed changes for internal affairs, and then finally kind of a little bit more on the process of what will happen in April.
Certainly, Councilmember, that third bucket was the actual reimagining bucket, if you will, and that is the bucket that we really have focused with the task force. That included things like parks, it included things like training, it included a variety of items that certainly the task force is looking into it more on the how services delivered than the more administrative what can be shifted. But that is certainly work that will come forward, we hope, with some of the work group recommendations from the task force. And we as staff didn't want to get ahead of that, as really that was part of the conversation we wanted to have with community. I would say that the other portion of that is that some of our engagement goes beyond the task force, and we really want to make note that we have undertaken efforts to really talk a bit more broadly with community. Alicia Dean on our team has been amazing in CPIO, along with Carrie and Alba from the Innovation Office, Alba, who is now leading our resilient efforts, Sereno. They and Brian, they really helped create a community's dialogue conversation that was scenario based, not necessarily about RPD, but just any scenario where you really, as I have mentioned it a lot in our community conversations, we ask community, how do you want law enforcement to show up or not when you are in times of crisis? And we will be adding that to the discussion as we come forward with those recommendations. The task force has been meeting now for a while. Again, those meetings are public. Folks can certainly go see those. We have the meeting tonight. We will be focusing on one of the work groups, which is the community engagement piece. But we have other work groups coming down. Rooted in the task force meetings have been making sure that we hear from folks that have been historically most impacted by police violence in their lives. And so that Saturday session really is a listening session broader with community, and we will hear feedback then. The task force work groups will present some of the remaining recommendations to the task force as a body to vote on. I believe the tentative date for that is April 14th. And then we will bring that forward as part of our mid-year sort of follow-up that you had asked us for in the budget direction on April 20th. So that is how that is moving forward. On the other items that you asked about in terms of internal affairs in particular, I'll say that we have been reviewing that. We have done a lot of research on that. We are touching base with law because there are some sensitivities to thinking through a potential decoupling. But we will, as soon as we finish that, and we may need to come into executive session, but as we finish that and move that forward, we will certainly be coming to council to have a more thorough discussion, but we are not finalized with that yet.
I think I see. Councilmember Ellis, do I see your hand? I do. Councilmember Ellis and then Councilmember Tobo.
That's a hand. I wanted to make sure that conversation was finished. Can I hear a little more about how the initial weeks of the ET3 model are working? That's something that I had worked on during the budget, and I know Councilmember Alter had done work too on the staffing and increased vehicles for EMS. Have you seen any early successes, or is it still too early to tell how that is helping alleviate concerns about emergency rooms and where people are able to be transported to?
I think it's too early to be able to give you an update on that. Some of the agreements just have been finalized, and with the ice storm that delayed some of that process. Although, like I said, we did use the telehealth and our consult line along with chief medical officers, department, and clinicians to keep people at home. So there was success stories there in keeping people at home instead of having to transport during for very low or minor emergencies that did not need an emergent response during the snow.
That's really helpful. I look forward to seeing how well that program does moving forward. And certainly appreciate the mention for the Workforce First program. That's a program that started in District 8 before I was in office. I've been happy to lead on it, as have a lot of my colleagues, to support that program. But I think it's a great way to help people in need of employment to help in the city. So thanks a lot for that.
Councilmember Tobo and then Councilmember Alter.
Thanks very much, and I appreciate the comments. Thank you, staff. Thank you for the good work, and also thank you to my colleagues for making the point that many of these programs and initiatives have been in conversation and some implemented prior to this last year. And I think what would help me, this is a very helpful layout of information. It would help me to have some dollar amounts associated with these different programs so that we can really see what the investment has been program by program by program. I had some specific questions. One of them is, well, a couple questions. We've had different conversations around the hotel strategy and where and the origins of the money. So could you help me understand when it, oh, I see, I did not print out that page. With regard to the support for hotel strategy and mainstream voucher program, it's my understanding that we're using bond funding for the purchase of the hotels and reinvested funding for the services. Is that still accurate, or is it contemplated that we would, for additional hotel purchases, we would go beyond the bond funding?
So these dollars are not for the purchases of the hotels, but for the staffing and the services and the contracts that would happen once they are purchased.
Great, thank you. And I want to turn to the program involving the Downtown Austin Community Court. With regard to the expansion of mental health resources. I'm not sure who is best to speak to that program. Is that the one that responds to the resolution that I brought along with my colleagues in December that relies on funding that the Downtown Austin Community Court had available, as well as the Downtown Austin Alliance? And these are shoring up mental health resources for individuals who are on the waiting list at the DAC, or is this a different initiative?
Hi, Robert Kingham here with the Downtown Austin Community Court. This is a different initiative. The resolution from December was for healthcare services and mental health services, with integral care as well as the DAA also funding a portion of that.
Can you help us understand the difference between the two programs, and has that other program started yet? I know the hope was to get it up and running as the new year started, but then of course with the storm and everything else going on, I understand that may have been delayed.
Sure, it was a bit delayed. We just got the fully executed contract last week, and Integral Care is currently in process of hiring staff to ramp up that program and get it off the ground ASAP. The program in the presentation was the expanded EMCOT, expanded mobile crisis outreach team. So that was behavioral health personnel embedded in the 911 call center, as well as having a mental health professional in the field to respond in either in conjunction with APD and EMS or by themselves. This is deemed appropriate that a behavioral health specialist can respond to a mental health crisis and without law enforcement present there.
So as we look at the slide on page 9, there are much needed outreach individuals being added to HOST and to MCOT. And so the additional HOST team members, the 3 additional team members that Integral Care has hired for HOST, are in it, and it says that they're actively recruiting to fill other positions. How many other positions will there be within that HOST program?
Councilmember Tovo, my understanding is there is a total of 5 positions for that particular team, or that portion of the team. They have 3 that are on board and are actively working now, and they're working on filling the last 2 positions.
Great. And so MCOT will be dispatched through the 911 system. HOST will be more proactive. I guess this is really a question. I mean, it was designed to be more proactive and out in the field, building relationships and meeting needs as possible. Can you help me understand whether that role has changed for HOST, and it will too be dispatchable? There's no number that people can call HOST if there's an individual who is in need of that contact. Really, this is more of a proactive approach. So has that mission continued along the same lines, and is the geographic boundaries of HOST as it expands going to stay the same as well, or are the geographic boundaries expanding beyond what they currently are, which is downtown and up through West Campus up to 29th, though I understand HOST has been dispatched well outside of the downtown and university area.
Yeah.
So sorry to bundle all those questions together, but.
No, not a problem, not a problem. So just speaking directly just to HOST, we have made every attempt to keep it in the defined areas, and it is a proactive resource. It's not a responsive resource. So just like it started out, and it was and the way it was intended to be set up. And after many long conversations, I know you and I were in quite a few different meetings with Bill Bryce and others. We've tried to remain as strictly to that mission as we can. But there have been some situations where there's been a extenuating circumstance where the resource has been requested, just outside of the downtown area or wherever. So, of course, we don't want to leave anybody behind, but if we can help it. So we've stayed to the fidelity of that particular conversation in the very beginning. But we are going through a process right now that Hugh Valdez and his team, Laura Williamson, at Community Court, are helping us go through and come up with a needs assessment. I believe that may have been a request that came from you earlier in the year to do a needs assessment for host, and we're going through that right now. And so we'll be coming back to you, I think, in the next few weeks or month to present the discussion and what those findings are.
Great, thank you. So so as I understand that, host is kind of retaining, and thank you, I like that, responsive. I'm going to use that term in the future. So host will continue to be a proactive resource, using the same geographic areas, but it is expanding to be kind of a larger number of resources on it.
Yeah, and that's where we struggle, because people know, the word's gotten out. So certainly people know, and they want us to help where we can. What we've done is like, for instance, APD and Integral Care that we work with the PATH team outside of downtown, and all of those things. We've worked really hard to keep to the model that we agreed to in the very beginning. I won't say that the team has never left the boundaries of downtown. We've made conscious decisions to try to bring in resources from PATH or whatever, to keep host in that downtown. That's their focus. I mean, they do maintain a very prominent presence in the downtown area and West Campus. That's the bread and butter of their work.
And I just want
Great,
to
thank you.
make sure that the point is clarified, that EMCOT serves is not specific to homeless individuals, and that serves the overall community as well. And so just make sure that there is awareness to that point.
And can I ask one last question? And that is, and I apologize because I know you all have explained this in the past, but can you please just remind us what the difference is between the community health paramedics who are providing mental health response and the EMCOT responders? Sure.
So the community paramedics are they're paramedics within our department. They work under the community health paramedic program umbrella, and they work in a variety of different capacities. But we're working on making them a resource that would be first in line to respond to appropriate psychiatric emergencies. Those that are nonviolent, don't involve weapons, and those that are deemed appropriate for that. So we're getting them rolled out into the front lines here very soon. EMCOT, or Expanded Mobile Crisis Outreach Team, they are employees of Integral Care. They are all master's level clinicians, and that team specifically works with police and EMS in responding to requests when a police officer or an ambulance crew is on scene with somebody that meets a particular criteria. And we dispatch them actually through EMS. We dispatch those resources to our crews, and so it's host and the Integral Care staff within host are kind of in a different area of their organization, and MCOT is a different part of their organization, and they respond to 911 related incidents.
Thank you so very much.
All Chair. Harper Madison had to step away, so I think we can maybe take one more question before we move into the last parts of the presentation. I saw you both, Council Members Kitchen and Alter, both raise your hands.
I can defer. I don't need to talk about mine now. So
thanks, Councilmember. We just still have a couple of presentations left. Councilmember Alter.
Mine will hopefully be quick. I was hoping that Ms. Stark could speak about, with the Office of Violence Prevention, the gun violence prevention aspects, which was one of the key reasons for setting up the office. It was not mentioned in your presentation. So I was wondering if you could speak to that briefly, and I'll just flag that my office will want to have another meeting with you soon on that topic as well.
Certainly. And so the team had a good meeting, and I'm going to forget the person's name, but with a member of APD, the data analyst, and he gave us some information about existing programs that APD has had for to provide safes and locks. And so we're going to expand on that and plan a community event to distribute that part of the program. We're also working with that consultant team that I mentioned earlier about the national experts to give us some guidance around what a campaign around gun safety would look like. We did get some good information about the thefts of guns and where they're concentrated in the city. It was in the area of the domain, and so we're gathering that information so that we can have a focused strategy around the need for safety and plan those events in that way. But yes, that is part of the plan. The second piece to that is that we are working on 2 consultant agreements to do a deeper dive into the police data to help us pinpoint areas where gun violence is more prevalent, and then work on strategies that, in conjunction with APD, work at the root causes of some of that. And that ties to the youth violence program that we're looking at to pilot in this year. But yes, I'll definitely follow up with you with some more information.
Thank you for that clarification. I look forward to the additional information and the good work.
You're welcome. Thank you.
Well, thanks, y'all. I know that this has been a lot of work, and after some time at the city, we know that sometimes these things take longer, and I appreciate that actually many of these things have gone a lot faster to get implemented, so I appreciate that. Before I move us into the next item, since it looks like we probably will have to go past 5 p.m. to get both items in, I wanted to check with staff if there is one of the 2 items that we should take up first. We have the briefing on the Regional Intelligence Center as well as the Austin Area Wildfire Hub. And I don't think it matters to me which one we take up first, but I want to see if there's any staff that really would prefer us to take one up over the other.
I believe, Councilmember, and I'm going to be withdrawing myself at some point here to get ready for our task force meeting, but I believe the ERIC item would go first, and then we will finish with the wildfire presentation.